Before we dive into that, I want to talk a little bit about this notion of empower. We've commented it already a few times through the program, but what really is this? And what are we doing in New York? What are we doing to so-called change the course of myeloma? We focused on changing the course of myeloma because we've already described today that the course of myeloma within the African American community is not acceptable. Blacks are twice as common to get myeloma, and yet their survival is half that of white Americans. But we know it can be better from the studies that we've done. And so we need to have a concerted effort, and the IMF is leading this effort. We have the privilege of working in conjunction with Memorial Sloan Kettering in New York City, as we have done in multiple other cities, not just to descend in a city and disappear, but to descend in a city and stay. And that's what we've been doing. So as I showed a little bit earlier, that myeloma Power, or Empower, is our logo. And this is our initiative to improve the short and long-term outcomes of African-American patients with myeloma. It's a bit of a play on words with the letter M standing for myeloma and Empower, really to speak of this notion of empowering people, that so often with the diagnosis of cancer, people can feel powerless. And people can feel that there isn't support and help for them, and we want to provide that help. And what we're seeking to do is increase awareness of myeloma in the community because it is so common, in particular within the African American community. Provide education through deep community engagement. That's what I'm going to be sharing with you over the next couple of minutes, what we're doing to try and engage in the community with MSK and with so many others, medical and non-medical, to touch the hearts and the lives of people who may have and do have multiple myeloma. That through that, we can shorten the time to diagnosis, because that's one of the big parts of the health disparity here. That's a big part of the inequity, is that it takes longer to make the diagnosis within this community. And we do that through self-advocacy and healthcare education. And then also on the provider side, to teach our docs and nurses and pharmacists and social workers and everyone who's a pharmacist, all those that are involved in the care of our patients, to provide more culturally sensitive care, all the while trying to support the myeloma community. And so the concept here is that we want to empower you today. I mean, you can change the course of myeloma in your community by knowing the symptoms, by speaking to your doctor. If you have some of these signs and symptoms, it could be myeloma. We don't want everyone to leave this workshop thinking, oh my goodness, I have myeloma, I better run to my doctor. But we do want people to be aware so that there isn't that lag. And should you be tested for it, and tell your friends about it so that they can similarly follow the same path. And so we piloted this program last year in the spring of 2021 in Charlotte. And we've had the privilege of having an Empower program in Baltimore and Atlanta. And now really we're kicking off what has already been months and months of work with our friends at Memorial Sloan Kettering, Empower New York. And there are other cities that are coming in the near future that you're going to hear about in Tampa and Detroit and other places, as we seek to have both a national program, but also individual program in each community. Because we've come to appreciate, as we all should know, that every community is different. And one strategy, one community may not be appropriate for the next community. That's why we have to individualize it per community. And so part of that community outreach, and I'm not going to go through everything that I've listed here. I just want to give you a flavor and a sense. We've created this Empower website that you can go to, empower.myeloma.org. And the idea there is to provide resources to people, especially during the pandemic, where it was very difficult to do this in person, although we're very excited about being able to do this in person, in particular in New York, in the months to come, where people can learn more about the details of what we shared, understand what myeloma is, hear stories of individuals and patients who have gone through it. I do a whole series of Facebook Lives and social media events every time we have a research meeting where things have been presented about health disparities so that people can happen. We participate in other healthcare forums like the Black Health Matters Summit, where we participated in multiple ways. And we try to collaborate with different communities. And so in one community, we may focus in one particular area. For example, when we were in the Baltimore area, they had an outreach program for cancer, but it didn't, within the African-American community, but it didn't talk about myeloma. It only talked about the so-called big four: breast, lung, colon, and prostate. Well, we added it to make it 5, to add myeloma. We provide education about what financial resources may help people. One of the problems we identified earlier was access to care. And so we want to improve that access to care so that people's insurance coverage can be reviewed. We want to provide any and every opportunity for people to share this among their community. Robin mentioned earlier that we had an individual in Buffalo who's been going to health fairs and barber shops and salons and other places giving out brochures and information. And so we provide those for anyone listening today, even who wants to be able to participate in that way, that they can indeed do that. We've created this toolkit at the website that can give people lots of details, including how to find a support group. We mentioned in our earlier discussion that there are ways directly on the myeloma website, but even on the Empower website where we can do that. And there's a whole series of resources, including resources for the care partners and caregivers. We think this is really important, as we've heard today, and as we're about to hear from Terrence and Tony. Myeloma is rarely a single person's journey. It often involves many others within the family, and we want to be able to provide an opportunity to help in any and every way we can. One of our marvelous patient advocates, who herself, she's a nurse, Tiffany Williams, is pictured here, where she can talk and share with you a bit more of a personal story of what it's been like to go through the story with multiple myeloma. We've also, in this program, not only tried to seek the lay community, if you will, where we partner with both medical and non-medical partners. We also want to really work within the primary care community, because this is where that diagnosis gap exists that we want to shorten. And so we've had the privilege of doing lots of programs in conjunction with organizations like the National Medical Association and others, where we reach out to primary care providers, especially in those areas, as you saw in Dr. Usmani's map, where there are a larger proportion of African-American patients, to recognize the signs and symptoms of myeloma, to make sure they can distinguish it from things like diabetes that can sometimes confuse the diagnosis, what tests to order, and when to refer to hematology oncology so patients can be seen in a timely manner. This is just a picture, for example, of the little postcard that we created to go along with this education, so the docs can learn what are the basic signs and symptoms and what tests they need to order. Because, as I mentioned earlier, often these tests are not naturally run and done. And so also, we've tried to provide an opportunity to put this into the published realm, where Amy, who's you're going to hear about in a moment, has been working with the Nurse Leadership Board and have published a paper for nurses so that they understand what the best practices are of the care for patients with multiple myeloma who are African American. And similarly, we're trying to do this with physicians as well. And we've just put together a group of docs to do this. But here's a picture of the best practices for nurses paper that Amy was very central and involved with. And indeed, we're doing one with physicians as well. So we're really trying to reach the community in multiple ways, within the general community, within the primary care community, and within the specialist community in hematology and oncology, to raise awareness of myeloma and to improve the outcomes of our African-American patients. I can tell you that I just made this slide last week, and I think we're almost at 300,000 hits now on the Empower website. So lots of people are being reached with this. And you can learn more at our basic website, myeloma.org. I mentioned we have an info line at 1-800-452-CURE, or directly at the Empower website, m-power.myeloma.org. Even if you just put Empower without the dash, you'll find your way there, so that we can provide these kinds of resources to you. And we hope that this is going to be helpful to you going forward. So now